Hello, good morning. Welcome to my channels. My name is Violet Okolocha. Today I'll be doing a video on important tips you must know before your OSCE exam. Actually, I'm doing this video because a lot of persons wants me to do it. So please endeavor to share these videos and endeavor to subscribe if it's your first time of watching. Okay, so now let's get started. Number one tip: be very bold. Be very confident. Don't be anxious. You are a nurse, and that is one quality that brought you to the UK. You are a nurse. So be very bold and be very confident. Don't be scared. People write OSCE exams the second time or even the third time because they were anxious, not because they don't know what they are doing. It's just because they were anxious. Okay, guys? All right. So don't be anxious. Be very confident. And number two, endeavor to fill all the details very correctly. Now, if the patient's respiration is 24, endeavor to fill it in the box of 24. Some persons make mistake of filling it in the box of 25. Endeavor to fill it correctly. Okay? If the patient is on air or is on oxygen, endeavor to fill that. Just make sure you are filling it at the exact line. Check, double check and make sure you are filling it at the exact line, because guys, that can make one come back. Okay, and after which, calculate all your numbers correctly. If the person is having a new score of 5, make sure you put in 5 there, and make sure the escalation of care is there, and make sure your initials is there. So be careful when filling this and make sure you're filling it correctly. Okay, beautiful. And now, if you are having a community setting is maybe they give you implementation to do, and they ask you as a community nurse, go to the patient's address to give the medication. Watch out for allergy. Yeah, watch out for allergy. If you are having a community setting, the drug chart they are giving to you is just 2 sheets, just 2 paper, one and the other one, and they are both stapled. Yeah, watch out for allergy, because if you're going to the patient's house as a community nurse to administer the medication, the patient is not wearing any allergic band, so most people tend to forget to ask for allergy. So watch out for allergy. Watch out for when last the patient took paracetamol. Yes, in all setting, you may be giving paracetamol 10 o'clock and maybe they didn't put if the patient are taking it or not. Ask the patient, have you had paracetamol? And if you have had, what time do you have it? And make sure to double check with the patient. Yeah, when I did my exams, the patient had paracetamol by 7 a.m. I told the patient, are you happy if we go over it together? Yeah, and the patient said yes. I said, okay, 7 to 8, 1 hour, 8 to 9, 2 hours, 9 to 10, 3 hours, 10 to 11, 4 hours. And I said, okay, beautiful. So now I'm supposed to give you paracetamol by 12 o'clock. Are you happy for us to go over it again? If you have the time, go over it and be confident. Calculate it over and over again. Okay? Don't be in haste and don't be anxious. As you're doing that, make sure you're checking your time. Yes, some people give medication and they have 5 minutes left. Yeah, medication is, I think, 15 minutes. Maybe it's not 12, I don't know. But when you're giving medication, do it rightly as you should have done it in a normal clinical setting. Don't be in haste rushing. The time is going quite all right, but you have to do the right thing so that you don't have to come back for that exam. Okay, guys? So double check. 7 to 8, 8 to 9, 9 to 10, 9 to 12. We've had scenarios where people think it's 4 hours. Perhaps it was 3 hours. Okay? So just make sure after giving, you write your signature, you write your date and your time, and you sign. Don't forget to sign. And even on the medication pod, you may notice now you'll see +3 days. If you are having a medication, probably this is the medication and they wrote +3 days. It means from that day you are given the drug, it has 3 days ahead to expire. Don't get confused. People say, what is +3 days? +3 days means it's in 3 days time the drug is going to expire. +4 days means it is 4 days time the drug is going to expire. Okay, guys. Now also, if you're having subcutaneous injections to give or IM injection to give, watch out. After withdrawing your medication, after you have checked and validated the medication that is okay to give, after withdrawing, we use a scoping method, right? You scope back because, yeah, and you go ahead and give the patient. Now, after administering the injection, you don't scope back, guys. Yeah, after administering the injection, immediately you withdraw sharply, straight to the what? Straight to the sharp boss. Please and please don't scope back after administering the injection to the patient. Okay, guys? And also, if you are having IM or subcute. But be very smart. If it's subcute, you pinch, right? But if it's IM, you stretch. Most people mix it up. For IM, they pinch, and for subcute, they stretch. So don't mix it up. OSCE exam, like I keep saying, is very, very simple. Just don't be anxious. Okay, guys? Now, if you are having fluid balance charts in your OSCE exam, I will advise you to test your calculators. Yes, before the exam starts, examiner, please, are you happy for me to test the calculator to know if it's in a good working condition? And she'll tell you yes, or he will tell you yes. Test the calculator. Press 5 times 2 equals to 10. If it gives you 10, try it again. If it gives you the same score, then you know the calculator is in a good working condition. Just so you make sure your calculations are very correctly. Okay? All right. Now, also, if you are giving medications, watch out for some trips. Yeah, there may be some tricks. The patient may be allergic to fish. If a patient is allergic to fish, of course, there's no really drug that contains fish. It's just to tell the patient, oh, you're allergic to fish. All right, so we'll make sure we don't give you any products containing fish. Yeah, it's possible your patient may be allergic to fish. Yeah, your patient may be allergic to fish, to plasters, whatever. And please, if you make a mistake in the OSCE exam, verbalize it. Verbalizing your mistake does not mean you will not fail if you make a blunder, but it may prevent you from failing. For instance, if you have ANTT and you are contaminating your pack, verbalize it. If you verbalize it, it now left to the examiner to know if to pass you or fail you. But most times when you verbalize your mistake, depending on the extent of the mistake, you may pass and you may fail. So don't think when I verbalize all mistake, it means I'm passing. That's not really correct. It depends on the extent of your mistake, okay? Yeah, and please endeavor to watch out. If a patient is allergic to penicillin, be very careful with the drug. You may see coamoxiclav, you may see amoxicillin. Okay, so be very watchful. And if you don't have an idea of the drug you are given, there's a BNF there. Check it. Don't say, oh, my time will go. Please try and just get a link on it. The time is actually short, but if you know what you are doing, the way you know how to do it in the world, the way we do it in the world, you will say the time is sufficient for you. Yeah, some people even finish 5 minutes before time and they are standing waiting for their time to finish. Yes, if you know what you are doing. So those are the important tips I think I would like to give you. If you have any questions, I'm available to answer all your questions. Just pop it up. If you have any questions, pop it up. I will do my best and I'll answer. And some other colleagues who have passed their OSCE will also answer. And don't forget to double check with the patients their full name, date of birth, hospital number, or full name and date of birth, and ask for allergy before finally giving the medications to the patient. Because once you've given the medication to the patient and the patient is allergic to the drug, of course, you know what it means. You have to come back. That is not your portion. So read well, prepare for your OSCE exam. Don't be anxious. Success in your OSCE exam. Thank you for watching. Don't forget to subscribe and share my videos. Bye.